helping to make your life easier. Local every day.
Today we are talking about the difference between food sensitivity testing and food allergy testing. Dr. Hannah Newhouse is an allergist immunologist with Allergy, Asthma and Immunology Associates. Nice to have you here today.
Yeah, thanks for having me.
So what is the difference between food sensitivity testing and food allergy testing?
Yeah, so food sensitivity testing is, it measures what's called IgG to specific foods. And so IgG is a little more of a general antibody, and so it measures more level of exposure to that food. Okay. But so with that, we expect, since we've been exposed to a lot of different foods over our lifetime, we expect to have a lot of positives too for IgG to those foods. Mm-hmm. But what it doesn't tell us is what kind of symptoms you might have upon exposure to that food. And it doesn't tell you increased likelihood of an allergic reaction to that food. Now compare that to food allergy testing, which food allergy testing measures what's called IgE to specific foods. And so IgE is more of an allergy-specific antibody. And so with that, so the higher level of IgE specific to that food, then the higher likelihood a patient is to have some sort of IgE-mediated symptoms when they eat that food. So that's usually faster onset symptoms such as kind of hives or swelling, vomiting, difficulty breathing.
Okay, so what should patients and families know about these tests prior to being tested?
Yeah, so with the sensitivity testing, I think just kind of also realizing that just because you've been exposed to that food before, that you'll probably have more positive tests for that. And so with that, they might not be as helpful for helping to guide elimination diets. Okay. Versus food allergy testing. So with that, so as with any test, so you can have a risk of false positives with that. And so for that reason, we try to avoid kind of blanket food allergy panels because of that risk of false positives. And so we don't want patients to have to unnecessarily avoid foods because of a positive test. So if patients have concern for a possible adverse reaction to a food, then we try to have them really try to pinpoint which food that they are concerned about. So that way we can direct our testing to that food and try to be more helpful rather than have them avoid things they don't need to avoid.
Okay, and if people have questions, want to know more, they should just contact your office?
Yeah, absolutely.
And figure out how to proceed from there.
Yeah, that sounds great.
All right, Doctor, thanks for coming in today.
Yeah, thanks for having me.
Appreciate it. And for more information on Allergy, Asthma and Immunology Associates, just go to 1011now.com.